Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I'm talking to the who's who of health tech and healthcare innovation. And today we are getting into that wild and increasingly competitive space of care navigation, care coordination, member advocacy. I'm not even sure what we're calling it anymore. But the bottom line is there's a lot of innovation happening in that space in both the product sense and the payment sense. And there seems to be an increasing market demand for it. So here to tell us all about what is going on is the CEO of Quantum Health, Zane Burke. Zane, it's great to have you here.
Hi, Jess. It's great to be with you today.
So excited to talk to you because, we've spoke before, we spoke at Vive. You were new in your position, and it's exciting because Quantum Health is like one of those kind of under the radar companies, but you guys are actually a leader in this care navigation space. And I understand that you are today announcing a brand new product. It's called Quantum Health Access. And so, of course, I read the press release and I'm seeing words like flexible, customizable, entry point solution. So I'm wondering if we could start the conversation off there and talk a little bit about Quantum Health Access, what's new about it, and probably most importantly, so people get a sense of context, how this is different from what you guys are already offering the 450 large self-insured employers that you guys work with.
Yeah, so great question. And as you described, Jess, we're doing it for 2.4 million members today and approximately 500 companies. So over 20 years of results and experiences have led us kind of to a point where we know what works and what doesn't work. And we've had what we've called quantum complete model for that past 20 years that we've refined and honed and really created great outcomes from incredible net promoter scores to great ROI to incredible engagement. One of the things we learned along the way, though, is our clients are in a little different places. They're all in different journeys of their own. And so we were super successful when a client wanted the whole complete model, which was basically to turn over everything to us except for the payment of the claims and the network itself. And in particular, large clients may have other needs. So they may have multiple healthcare plans. They may like their clinical services. They may like some of those elements. And so what we figured out in that journey is that we can provide a high quality service by just turning off a couple of elements and really getting them started on quantum health style navigation. And so what this is really about is more flexibility to meet particularly those larger clients on their journey and where they are. And we're doing that in multiple ways on the flexibility side. So when you think about it, our clients are sitting here looking at hundreds of digital health solutions today. They're looking at all sorts of macroeconomic elements around the Great Resignation. They're looking at inflation. They're looking at increased healthcare costs, and so their world's getting more complex all the time. What we're really trying to do is simplify the journey for them at the end of the day. So Access represents one of those simplification strategies. And much like we do for our members, for the individual patients, for the people that we serve, we want to make that journey as simple as possible for our clients, everything that they're doing. And so Access represents one of those simplifications and one of the abilities to jump on to what is a great proven track record from a navigation perspective and start the journey of healthcare navigation.
Right, simplification is not always a word that we hear in healthcare. So that's exciting right there, Zane. I want to unpack this a little bit further with you because, it's like, okay, I'm thinking, to some of the other players in this care navigation space. So you have somebody like Accolade, who last year, in addition to their advocacy navigation, they added primary care. Or you've got a company like Rightway, which in addition to their care navigation, they've added PBM stuff to it now. So why right now launch something like Quantum Health Access, and why choose this type of solution to launch? Like, why not, add on care, or why not add on, pharmacy benefits or something else that expands your ability to continue to control costs along the care continuum and like vertically integrate? Why choose to do this instead?
There's two things. It's not an instead conversation. It's an and conversation. So we actually introduced our complete care solution ecosystem, which incorporates many of the things that you've talked about, whether it's pharmacy strategies, whether it's primary care, digital health elements, And in that case, where we're literally taking the data, we know which digital health solutions work, which ones don't. So for instance, when I was at Livongo, we knew if you were a Quantum member and a Livongo member, you got 30% higher engagement.
Wow.
35% higher enrollment than our book of business. And in fact, some of the other navigation companies had lower engagement and lower enrollment. And I didn't understand that when I was at Livongo. What I got to understand at Quantum Health was the way that we engage the member, the provider, the client, and really bring everything together in a single member experience is really the right strategy. So what Access represents is how do we bring that whole strategy together for more clients and make it more accessible for clients who are on a different kind of a journey, so that I can bring in all those things that you mentioned, whether it's pharmacy, whether it's primary care, whether it's integration into oncology, second opinion, all those elements, because healthcare is getting more and more complex, not simpler. The access element allows you to get on a platform for the future. And that's really what our clients are looking for, is who can manage this platform, who can make this simpler, who can really simplify the journey along the way. And so the why now is this actually just allows us to get to more clients so they can get to all those other things. We already have the experience and have already put together many of the programs to derive higher value equations from. So this access platform piece just allows us to get into people that are on a little bit different journey.
Okay, no, that makes a lot of sense. And your anecdote about your experience at Livongo is really interesting to me, because like this kind of is the perfect segue into my next question. Because it's like it seems like, especially over the last couple of years through the pandemic, as people's care journeys started out more and more online, more and more with a digital first experience, that there has been a lot of focus on that single point of contact, that single starting point, and having that single starting point pretty much be online. So I'm curious, to ask you about that, like starting place, because it seems like that starting place, like once you have the start of the journey, you have the ability to really impact and make a difference in where that patient goes next, and the continuation of their care thereafter. And this is something that I'm seeing not just with navigators, but you're also seeing, the increasingly member journey focused health plan, or the digital front door system, being, bolted on to the health system, or, like you said with Livongo, a ton of digital health point solutions that are a starting point, or telehealth providers, or even like the age old, initial starting point, the primary care doc, virtual first or not. So when it comes to like a care navigator, I'd love to hear your perspective on this. Why should an employer, why shouldn't employees start their journey with a care navigator, particularly when they have all of these other alternatives out there as places to start? And they're already paying for a lot of these other places to start. Why add on the expense of having a navigator?
Well, first off, we've seen a hard ROI with our clients. So our clients are experiencing significant ROI, over 2.5 to 1 on their ROI experience. And across our book of business, our clients are seeing, we've surveyed our clients over the last 18 years, and we had over the 3-year period of 14.5% savings on all healthcare costs when they are a part of Quantum Health. So the first part of this is really, it's an investment in the ROI side, but really this is around creating a great experience up front at the same time. So we're seeing, our net promoter scores are in the mid 70s for our members, which is unheard of territory in healthcare. Providers have a 70 net promoter score. So people that when providers engage with us, they have that kind of net promoter score. No one else touches providers, oh, by the way, in navigation. And so one of the unique elements in our model is our ability to engage in that space. So what's different here is creating great experiences, great clinical outcomes, and financial ROI. And the way to do that is uniquely in a quantum model is you can't access healthcare from a from a actual engage in the system without coming through Quantum.
Okay.
So, and we literally take every single piece of data, and if it's like they have a digital health solution, that's great. If they're part of our preferred partner system, Quantum has access to those same algorithms that are being used. We know what you're eligible for, how you use it, have all those pieces. We can synthesize all the data and all the experiences. And then we run the artificial intelligence in the background to take either the data points from your digital health solutions or from engagement in the healthcare system. So if you reach out to say, hey, I want to check my benefit strategy, you're not just calling to say, do I have a, I want to know that. I just FYI, I want to know it. You're about ready to have a healthcare journey. Mm-hmm. We use that as a health signal to literally say, something's about to occur here. What is it about to occur? And so certain things like, if you use the term specialist or type the term specialist into one of the digital health apps, that means 94% of the time, you're about ready to spend more than $10,000 in healthcare. That's a great predictor of something that we should engage with you and talk to you about that journey and make sure that you have a friend along the way. And because healthcare is so complex and it's so unique, it's not like other consumer experiences. When we engage in other consumer experiences, the consumer is usually responsible entirely for the bill. They want to actually do the service. People don't engage in healthcare for the service sake. They engage for healthcare because they want to do other things in their lives. Yeah. They want to spend time with their family or go to a concert or drink a glass of wine or whatever it is that drives them. Healthcare is truly unique. It's an enabler to the things we really want to do. Why to engage Quantum is we can create that great experience, the higher financial and clinical outcomes at the end of the day, and creating that single integrated member experience. It glues together all the connective tissue of a clicks and mortar world that is increasingly more complex. So that's why people do it, because it saves money and it's great experience.
Okay, well, I want to hear a little more about this because it's like there seems to be, okay, so I have to go back to the press release because that is the word here, right? And the press release cites this McKinsey Employer Health Benefits Survey, and it's talking about the fact that 40% of employers either have or plan to introduce care coordination, care navigation tools. God, that's like a surprisingly large number of employers. And then I'm like, well, wait a minute, what's going on with the other 60%? So of course I go in there and I take a look. And what surprised me actually is that there's the 20% that are like, no, not going to do it. But there's a big 40% in the middle. That's, thank you, McKinsey, for this very helpful designation of may or may not 20%. Or probably will. And I'm not quite sure what the difference between those are, but 40% are basically in a maybe mode. And to me, it's like, that's a lot of upside for a company like yours to, go and chase, but that's also a lot of convincing that you have to do. So I'm curious, Zane, when you're talking to the employer, because that's the client here too, right? I mean, in addition to their employees and your members, when you're trying to win over the skeptical client, I mean, is the engagement story enough for them? Or, does that win? Or it's like, do they really start to needle you with questions about how care navigators are just another hand in the cookie jar? I mean, how do you get past some of these skeptical employers in that big 40% maybe bucket?
Well, it's fascinating because employers have long thought of the carriers as this is their responsibility, but the carriers are really maximizing around their siloed systems, pay a claim, do the disease management, get you off the phone into somebody else's queue, and move you along as quickly as possible. Our model is, hey, every single one of those interactions is a gold mine, and each piece of that is a data point that we can actually harvest and say, this person is on this next piece. This week they could benefit from these other elements, and we actually don't create silos. We create a single team that has the nurses, has the benefit specialist, has the personal service representative, has access to the physicians, and it's a team that knows you as a member of a health system, of a employment plan, and can drive individual results for you and care plans for you and understand your benefits in a different way. And part of how our model works is we get 85% household engagement, 85%. There are no other
Wow.
services out there, they get 85% household engagement. And a more important statistic is that 94% of members that spend more than 10,000 in claims are engaged by us. And we engage with them over 85% of the time before they've spent $1,000. That's what's really important. So get to it early. And we do that through a tool we call real-time intercept. And that's part of our artificial intelligence, which is taking that health signal. That physician office reached out to say, I need to schedule an appointment for Jess DeMassa, and is she eligible for claims? Well, guess what? That means you're on a healthcare journey. And is that healthcare journey something that is routine? Okay, let's handle that in a routine digital manner. Or is that something that looks like it could be more complex? Let's handle that in both the digital and a personal way, which is truly unique. So when you talk about convincing clients, what I read from the survey is that 80% of the people know what they're doing doesn't work today. They just haven't had the opportunity to have a full appreciation for what the full models can be. And what part of what Access is about is making it, easier, simplifying the journey for people to get over the hump to say, I'm going to put my entire population at risk by handing over my plan to a Quantum Health in that space. And you think about that, that's pretty significant. So this isn't like the past world in digital health where you could try something in MSK, you could try something in diabetes. And we all know those were underserved marketplaces, but they would literally be like, okay, that's 8% of my population. And they've been not getting poor service anyway. So what bad can happen if we try Livongo? It'll only happen on 8% of the population. In healthcare navigation, you're talking about 100% of your employees and 100% of their dependents. So that means the CEO's partner or wife, kids are going to be subjected to the solution. So you got to be rock solid sure that this is going to work. And so part of what I would say in that 40%, 20% is this notion of it's a high risk element to do. And there's 40% that are convinced it's worth the risk. There's 40% we've got to create, and one, convince them, but two, create the models like Access so that they can make it easier. They can feel a little less concerned about joining up and giving away everything, having to start everything day one. And that's part of what Access does, is actually allows us an easier entry point where they can get the benefits of the model without having to give up all the control and have all the disruption.
I love that. I think that's cool. It's I like this idea of wading into this. All right. So you mentioned at risk, which makes me think about at risk payment models. And so this is something new in the care navigation space. I feel like I keep calling it at risk light because it's not fully at risk and it's not like the old PMPM model, but there's like a little bit of at risk where it makes sense. And like people are like starting to play around with this. So I'm curious about what you guys are doing at Quantum Health. I mean, so are you guys in an at-risk light situation or still a PMPM? Are you headed toward that? And like, what are your thoughts on this whole thing? And especially coming from Livongo, where you guys did have kind of an at-risk take on your population. I mean, you've seen how it can and cannot work. So I'm curious to hear what you're doing at Quantum Health.
Well, it's fascinating. We are fully comfortable with an at-risk model, but what I'll also tell you is Quantum Health started 100% at risk. And isn't that fascinating? Yes. And our client, what happened? So let's ask you a question. What happened? Guess what? The benefits were so good that the upside part became a challenge. And then also our clients want to have predictability, a little bit more predictability. So what I actually see is more of a blend of a PMPM basis, but having some elements more quote unquote at risk as part of that journey. And I think in a pure navigation space, the PMPM model makes a ton of sense because when you can literally step back and create the right kind of SLAs around ROI and experience, that can work effectively. I do think that as you see us move further and further on the care journey, we're going to continue to go after bigger, tougher issues because we actually do all the hard stuff. And I think we'll see more at-risk elements in that we'll want to do that. and we'll follow the clients where they want to go on that journey is kind of how I'd say it, because really my view of this is ultimately the market will set how you contract for this. We're 100% comfortable being fully at risk. But at the end of the day, most of our clients actually like the predictability of a PMPM basis.
That's interesting. I've heard that too. All right. So here's the tough question, Zane. What's the key difference? What's the key difference that we need to understand between Quantum Health, Accolade, Rightway, and Transcarent? What's the key difference?
Well, the key difference is Quantum is the only one that's tackling member, provider, and client. And
member, provider, and client.
And
okay,
client.
go.
So that's a great question. So if you're talking with other folks, and what I mean by that is you're proactively engaging with that provider office in a meaningful way. And if you think about, over 60% of the health signals we get actually come from the provider. So that means when you put the entire segment of navigation that in another, for everybody else, that means their data set is only 40% of what a Quantum Health look like. And then we're actually taking the data from our preferred providers like Hinge, like Oshi, like Teladoc, and aggregating their algorithms into the workflow of what our care navigation tools, both digital and when it's a personal service touch. So we're using the technology and the service enablement of all the investments that our clients have made to date and really creating that single experience. Everybody else that talks that game is really doing a pickup sticks of ecosystem. And really, it's literally, they look at it as a revenue generator. We could care less if it generates any revenue, and I mean that. This is really about the better experience and the better outcomes at the end of the day. And it's like the Livongo story I referenced early on, where if you're a Quantum member, you're just getting higher engagement, higher enrollment, and therefore much, much better value out of these digital health solutions at the end of the day. So it's a combination of how we work with the entire ecosystem to kind of really be that connective tissue in clicks and mortar world. And that's super unique to what we do. And then we just have much more data that we're utilizing to get the health signals so that we can fire our artificial intelligence against it and engage early.
So I know the engagement is a key thing here, but what really, Zane, has been surprising for me, and I'm sorry to admit this to all of the wonderful folks who are at Quantum Health, but the company has been around since 1999, and I feel like it did not even register on my radar in the health tech world. Now, granted, I'm kind of myopically focused, but it didn't register until you were put in place as CEO. And so, I mean, compared to some of these upstarts or like newer companies, if we can call them that, like Accolade or Rightway or Transcarent, it's like, how do you see, Quantum Health fitting into that space? Especially because, I mean, you guys are still like, you're private equity backed. You're on like a short list to go public. I mean, how do you stay after so many years? And how does Quantum Health, kind of reinvent itself to come back into the conversation here with some of these new entrants and like make a real go of it?
Well, we are the industry standard. We're the largest healthcare navigation player, period, in this space. And it's the 20 years of results that actually allow us to create those incredible experiences, incredible outcomes at the end of the day. And part of what this announcement is really expanding who we go to and the accessibility, no pun intended, but actually when you think about Quantum's access solution, it's really to make it more accessible to other companies. And so what we see is navigation, and if it's a pure digital space, just isn't enough. That's just, that when you're just touching at a digital level and really hoping nobody calls you, that's not going to work. And that's not providing real value at the end of the day. And there are those that do that. And then there are those that claim they aren't navigations, but they would like kill to actually do what we do in terms of getting the member in their life flow, creating great experiences and great outcomes, and having the kind of large, significant clients we have. My job is really about how do we make a story that's been a Midwest company that put their head down, did really good work, and believed in the results will matter at the end of the day, and they do matter. And so people in this space do know quantum health very well, but we need to get that story out there a little bit more. So that's part of this, the journey, but also making the platform more accessible for people, which is part of this news release as well, which is how do we make it easier for clients and simplify the journey for all. And I'm super excited about the ability to use the massive amount of data we have in a meaningful way to simplify the journey for members, clients, and providers at the end of the day.
I love that. It's like best kept secret, no more. But heads
Working
down,
on it.
working on. No, that's awesome though. And like I said, I mean, I'm very singularly focused on the startup-y space. So it's like it was a surprise to me to learn how long quantum health had been in business, and that's just remarkable. So, I have to wrap up by asking you this, Zane, because you're on the short list, like I said, short list of companies that are potentially making an exit or one to watch that could make an exit this year. So, any comments on that? I mean, anything you want to tell us here?
Our job is to take what's a really great company and make it even better and bring that experience to more people. We have great scale today. We're EBITDA positive. We have great growth, and we're going to have a lot of options in front of us. And if we just put our heads down and do the right thing, and it turns out doing the right thing for our members and our clients yields great financial results for our clients, it'll real great results for our shareholders at the end of the day. And so we'll see where that journey takes us.
All right, cool. Well, we will watch and hopefully be along for the ride here. It's exciting to see you, to see you leading such a company that's making such an important difference in the lives of so many people. I mean, would you say 2.5 million members? That's incredible. I mean, that's the fun thing about the scale of this company is just really tremendous, which is awesome. So congratulations, Zane.
Thank you so much for your interest.
All right. Well, thank you for joining us, and thank you for getting us introduced to your new access solution. So we'll have to watch how that starts to hit the market and what happens there. And I love this care navigation space now because it just seems like there's just so many different angles and so many different ways that different companies are trying to make an impact there on not only both the care experience and the journey for the member or the patient, but also on the cost side of things. So a space to watch, and we'll be talking to you again, I'm sure. Thanks again for joining us, Zane. I'm Jessica DeMassa, and for more interviews with the who's who of health tech as they are changing the way that we do healthcare, head on over to my YouTube channel. It is youtube.com/WTF Health. I'll talk to you guys real soon. Thanks again, Zane. We'll talk to you later. Bye.
Thank you. Bye-bye.